Hello everyone, and welcome to the newly relaunched MD Derm Outlet YouTube channel. If you're new here, I'm Obuhle, the aesthetic therapist at MD Derm Outlet, and our goal in this channel is to help you understand your skin better, and we'll be providing you with evidence-based information. And if you ever felt overwhelmed about skincare, you're at the right place. And today we're taking it back to basics. We have our dermatologist joining us today, Dr. Mathobela. Welcome, Doctor.
Thank you, Okushe, and I'm so excited we are doing this today and hoping we're going to be sharing some evidence-based skincare routines and clearing up so much misinformation that is available on the internet and on TikTok. And hopefully at the end of this channel, we'll help people build a skincare routine that actually works.
So, Doc, I think one of the biggest problems today is that there's so much information online and everyone seems to have an opinion about skincare products, skin treatments. And so let's start with the absolute basics. So why should people have a skincare routine? Is skincare only about looking good, about feeling good? Why is skincare routines important?
All right. So before we answer that question, actually, we must think about what most people think of when they think about skincare routines. I've noticed that every time when we talk about skincare, people think only about their faces. But your skin is so much more than that because it covers your whole body. It's the largest organ. It does the most. It's the most functional organ you can ever have. It protects you from the environment, the pollution. It protects you from harmful viruses and bacteria. And it also maintains your temperature if you think about it. But it can only do that if its skin barrier is intact. So your skincare routine should actually ideally be focused on maintaining and protecting your skincare barrier.
Yeah.
Think about your skin barrier as brick and mortar. So your skin cells are like the bricks, and the lipids in between your skin cells that keeps them together, that binds them together, are your mortar. So you want to maintain that. If the mortar is not fully functional or it has breaks, you will lose moisture and it will allow abnormal bacteria or not abnormal per se, but harmful bacteria and viruses and fungus to go in, and you'll be prone to infections, dermatitis, and all of that. So the main idea of your skincare is to protect and support your skin barrier. So face and whole body.
Okay. And one of the questions we hear almost every day is how do I know what skin type I have? Can you explain the different types of skin types?
So in general, if we were to speak in general, you'll have maybe 4 skin types. So there's the dry skin, there's an oily skin, but oily skin, sometimes you associate it as well with acne prone. But we have to be careful because sometimes people only have an oily skin and not necessarily have acne. So now we must say normal, we must say dry, we must say oily, we must say acne prone. And then sometimes comes in the sensitive skin. But also that is not always a hard rule because somebody with an oily skin can also have a sensitive skin. So your skin can be oily and sensitive at the same time, or it can be dry and not necessarily be sensitive because in most cases people associate sensitive skin with a dry skin, but it's not really. So it's not a hard and set rule that you have an oily skin and a dry skin because it can change all the time, and sometimes it can also bring insensitivity in. So it's not that yet, but just to clarify for most people to understand, yes, we can break them into normal, dry, oily, acne prone, and sensitive. But on sensitive, we're thinking people that have maybe rosacea and dermatitis. But an oily skin without rosacea can still be sensitive.
Okay. So can skin types change over time, and what causes these changes?
They definitely can change. With time, they can change with environment. You find yourself in Johannesburg and your skin is completely fine. You land in Cape Town and all of a sudden your skin is dry and sensitive. And again, seasonal changes. Somebody that has an oily skin in summer, come winter, that skin can be dry as well. It also depends on what type of medications you're on. So if you're on Oratane, your skin will probably be dry, though initially it was oily. And again, aging. As we age, our skins produce a little bit less oil than it did when we were
younger.
When you are stressed as well, the skin just unfortunately goes into an overdrive, and often it's a little bit more sensitive than you know it to be.
Okay. So now that we know our skin type, and let's talk about where people should actually begin. And then if someone came into your clinic today and they said, Doc, I've never had a skincare routine before. Where do I start? What would your advice be?
All right, so when we are thinking about skincare, or the main goal of a skincare should be to protect and to prevent.
Okay.
So those are the main two things that you must think about. So you must protect your skin from the harmful rays of the sun, because that can lead to skin cancer and pigmentation. And you must also protect your skin from acquiring some of the the skin conditions that can be acquired, like pigmentation. You also want to protect that barrier that we spoke about. We spoke about the brick and mortar and the lipids that are in between your skin cells that are keeping your skin bind together. So you want to protect and support them. So your skincare routine should not strip your lipids off, because obviously your skin is going to be porous and irritated. So that's the main aim, really. You protect it and you prevent and support it. So to do that, we're going to have to look at the three basics things. You obviously need to cleanse. Before you apply anything on your skin needs to be clean. So you're going to get a gentle cleanser that is going to clean your skin from all the impurities that you have accumulated during the day, the dust, pollution, sweat, oil, everything that you have applied on your skin. But you want to cleanse that skin without stripping it. So a gentle cleanser is the best way to start. Then we come to moisturizers. And when we're thinking moisturizers, remember we're thinking barrier support. So you want to use a moisturizer that is going to support and protect your barrier. So then usually when we speak about moisturizers, then somebody will say, but I have an oily skin. I can't moisturize. My skin is very oily. But you have to choose a moisturizer according to your skin types, as we've discussed them. If you have a dry skin, you look for something a little bit more rich. If you have an oily skin, you're going to look for something light, a gel type, or even just the hyaluronic acid will help to protect you, because then you're going to support that barrier. And if you are acne prone, then you're going to go for a moisturizer that is light and that is non-comedogenic. Then the sensitive skin people, they look for a moisturizer that is packed with ceramines, that is packed with ingredients that are anti-inflammatory, and also fragrance-free. That is very important for somebody that has a sensitive skin. When we are done with moisturizer, then comes the most important. Everybody must do this now. And everybody must have this. It's a must. So now we're talking sunscreen. And sunscreen, we are talking about a broad spectrum sunscreen. For most people, especially darker skin people with no skin problems, an SPF of 30 can work. But ideally, we hope everybody can be on an SPF of 50 plus. And your SPF needs to protect you from UVA, UVB, infrared, and visible light. And for visible light, ideally, your sunscreen must be tinted. And that is even more important for people that are dealing with pigmentation, because visible light makes your pigmentation worse.
Okay, so we've come up with a routine. So it's cleansing, moisturizing, and sunscreen.
And in the sunscreen, we must also now remember darker skin people. They always say, but black don't crack, I don't need a sunscreen. But that is not necessarily true. So a darker skin person, for us with darker skins, yes, the melanin protects us a little bit. It gives us maybe an SPF of approximately 13, but only UVB is covered. You still need to cover UVA, because UVB, yes, causes skin cancer, which is not the biggest concern for a darker skin. Of course, a darker skin can still get cancer, but it's not the biggest concern. Our biggest concern is pigmentation and photoaging, so premature aging. So the melanin protects us from UVB, but UVA is not covered, visible light is not covered, infrared is not covered. So we do still need to use sunscreen to protect from pigmentation and worsening the pigmentation, and also photoaging. I mean, we all want to age gracefully.
So now that you've given us the simplest routine, so if you could recommend like one simple routine for the morning and one simple routine for the evening, do I do all of this in the morning? Do I also do the same in the evenings? Because after work, taking care of the kids, having to cook, do I still need to have a night routine as well?
It is obviously important to do it both, especially when we think about cleansing. We said the importance of cleansing is to remove the impurities that have accumulated on your skin, the oils, the sweat, the makeup that you wore, the sunscreen. So it is important to wash your face both morning and evening. In the morning, you want to wash it and apply your sunscreen and moisturizer, or those who are using serums, do you want to apply it on a clean canvas? And in the evening, you want to clean it up so that you sleep with a clean skin. Your skin actually self-repairs better at night than it does. How is it going to repair with all that sitting on your skin? So you want to clean it up so that if you are applying anything active as well at night, you're going to be applying it on a clean skin. But when we're going to speak about routine, who must do what? Now, obviously, probably we'll have to speak about it in the next episode because it gets complicated. But for the most basic, for let's say youth, for your youth in the morning, you want them to wash, moisturize, and sunscreen. In the evening, you want them to wash and moisturize, right? And for slightly older people that already have concerns of aging, in the morning, maybe you want them to wash an antioxidant like a vitamin C, a moisturizer, and sunscreen. And let's not forget that the sunblock also needs to be reapplied during the course of the day, every 3 hours, hopefully. If you have pigmentation, even more. You need to be even more careful. And your sunscreen goes beyond just the sunscreen itself. You protect also with what you are wearing. In the evening, for a slightly older skin that also is thinking about, aging concerns, you want to wash. Then maybe you want to do a retinol and a moisturizer.
On top of that.
And if you are targeting pigmentation, maybe again you're going to introduce a serum that's also now targeting pigmentation at night.
Okay, so that makes a lot of sense. And have you come across in your clinic, what are the common mistakes that you've seen or heard that people are doing, that the most common mistakes?
Yeah, now if we were to go into that, it will probably take us now the whole day. We need just now another episode for only that. Lots and lots. So for the most part, sunscreen, the biggest mistake. So often we see people, I don't use the sunscreen. I've heard a lot about sunscreen. Sunscreen causes skin cancer. I'm black, I don't use sunscreen. So that's the first one, sunscreen. And for those who are using as well, one of the biggest mistakes they're using is to use
a tiny bit
of sunscreen, because sunscreen is expensive. But that's the one thing that you need to invest in, more than an expensive serum, more than an expensive moisturizer. First, get your sunscreen right, because protecting yourself from sun damage also protects you from aging and a whole lot of other things. Another mistake that I hear a lot about, over exfoliating, because I want glass skin, because everybody's exfoliating. Then they are washing with an exfoliating wash. They are using an exfoliating toner, applying an exfoliating moisturizer. And then you wonder why your skin is so sensitized and irritated and rashy. So over exfoliating and stacking up a lot of exfoliating products is also one of the biggest mistakes that I've seen here. And now also stopping your prescribed medications too soon, or changing from one product to the other too soon because I've used it for a week, it's not working.
It's not working.
Yeah, so sunscreen or skincare needs to be given time to work. Until you have at least used something for at least minimum 3 months, you can't say it's not working. So giving it time, but there's a whole lot more.
So Doc, before we finish, what's one skincare tip you wish everyone knew?
One or more.
It can be one or more.
All right, so the first thing, sunscreen, and starting it early. So we should start very early with sunscreen, teach our kids, because if they learn about sunscreen from an early age, from a young age, they will continue applying their sunscreens into their, adult years. And we'll save them a lot of money, spending money on trying to prevent or treat pigmentation, skin cancer and the likes. Secondly, give your skincare, and not just your skincare, but your prescribed medications as well, time to work, because consistency works. So giving it time to actually work, you will reap rewards, unlike looking for quick fixes, because those usually lead to problems and complications.
Yeah. Thank you so much, Doc, for sharing your knowledge with us. This was very much informative, and we wish to have you on our next episode as well. To everyone that was watching, thank you so much for watching. And if you enjoyed this conversation, please like, subscribe, and leave any skincare question in the comments down below. And we shall see you in our next episode.
Bye-bye.